Yep.
We're live, Charles.
We are? Oh,
We are live, Charles.
you are? Okay.
Aloha Friday, everybody.
Is any something wrong with my camera? Is yours on moving?
You're making me seasick. That's what the kind.
No, that's why something wrong with the pictures there. I'm trying to see if how I can control it. Is it stop?
No, they did not stop. I was getting seasick. Bring the Dramamine because I'm feeling seasick. How are you, Charles? How are you today on this fine Thursday evening?
Well, I'm doing great, my brother. I am doing great. Like to say aloha to all of your friends out there, your family and friends. Thank you for
Oh,
joining us. Yeah. Hope everybody had a beautiful day. It was kind of warm, yeah. Today was kind of warm,
yes, it was,
and it
and it still is.
yeah, I can tell when it's warm when my bibbies is stuck to my leg. You know what I mean? That's how I know when it's warm. But other than that, it's a beautiful day. Kind of overcast. I was
Yeah.
surprised. Never have that much traffic on the roadway. I was really surprised.
Yeah. Ed McDowell said Thursday. Hello. Almost Friday. Almost Friday. Yes, tomorrow's Friday. Hey, Board of Education voted a little while ago, extended the school opening till August 17th, 2 weeks. And we'll talk about that tonight with our guest, Dr.
Yeah.
Tony Trpkovski from Doctors of Waikiki. He'll be coming on at about 7 o'clock. But um, I'm curious to hear what he has to say. We heard from some teachers and medical personnel last night on our show. By the way, amazing viewership last night. Thank you all for tuning in, and that was amazing. I don't know, I think we're pretty close to 6,000 views right now. I don't know. I didn't check. It was
No, it's actually
5,000.
over. It's over 6,000.
Yeah.
Yep.
Hot item, a hot topic. Our kids, our teachers, people that we care about, and we're trying to do what we can to keep everything safe.
Yeah.
uh, we're hearing the numbers continue to climb. We hear kids now, more kids getting the COVID. Even heard that one, I think 9-year-old from Texas died from COVID. That and yeah, it's rare, but at the end of the day, we don't want to take those chances. We found out last night from the first hand from people that are doing it that we're not ready to open up. We definitely wasn't ready to open up on August 4th in the way of supplies and training and everything else. I still have doubts who will be ready on October 17th. Uh, some teacher just posted they got their supplies. They had one bottle of hand sanitizer, one shield, and an empty spray bottle. Uh, what are these? We heard last night the horror stories from teachers that have had no training. Um, will they be able to get it all completed for all schools, including the third party contractors that service the schools, the food service workers? Is this state ready, or will they be ready in with training all of these people by August 17th? I just don't think so. I don't.
Well, I will share with you one thing that makes me kind of wonder. With the state being the way they are and having to train all the teachers on the proper cleaning techniques, right? That contractor has to have all these certifications in place. Where do you find them? Because I know when I handled a state contract, the harbors, as an example, I had to make sure every single one of my personnel had their FEMA certifications, had their certifications from Homeland Security. They had to jump through hoops, and it wasn't done overnight. And I'm talking about a unit of 15 or less. It took me roughly about 2 weeks to get them all of their certifications. Now we're talking about an entire state to get somebody certified to clean. because they're gonna have to do the cleaning, and they're gonna have to know how to decon should something happen. It, 2 weeks is not enough. I mean, I don't want to laugh about it, but gee whiz, they really think that these teachers are miracle workers. Yeah, I mean, wow.
And there's a huge question about just getting the supplies, the PPE, and everything for the teachers. The supplies. We heard last night that every school is responsible for ordering their own PPE, and which makes absolutely no sense. You would think that the DOE would purchase all, right? One huge, humongous, few containers full of gloves and
Exactly.
masks,
Exactly.
and then they would disperse to the schools based on
Exactly.
enrollment, based on staffing. But now you go in small school, and then you got to go bid or put in your order for a little teeny tiny amount of PPE, and you go challenging these other big organizations or bigger schools that are ordering 5 or 6 times as many supplies.
Mhm.
It's just not gonna work, and then you're gonna
But
end up
it's gonna be
with
like that argument that they had last night, and that is about the test kits, right? Hawaii is competing with places that order 9, 10 times more than what Hawaii would order, right? So
yeah.
guess who gets in a line first? So these teeny tiny schools you're referring to, they're gonna be in the back of the line, and it's unknown whether they're gonna get their supplies at all. That's the danger of it.
I tell you what this state is doing is dangerous. And I know I've said this before, and I'll say it again once the doctor gets on, but this state is basing everything on deadlines. Deadlines. They're picking a date.
And
They
they're making
picked
everything work to
September
get that.
1st. Yep, they picked September 1st as the opening of tourism. They open up whatever his plan is, one test, and no need quarantine. So September 1st. He set the date October 4th for the board did for opening of schools. Now, this virus doesn't operate on a timeline.
Mm.
We've said this so many times. This virus doesn't care about dates and timelines. We don't know what this is going to do. And in fact, we know one thing, that this virus right now is very aggressive and the numbers are climbing every day. More today than yesterday and more than the day before. So we know that. We know that right now this virus is in a growing stage.
Mhm.
It doesn't give a rip about the date on the calendar. So why in the world are we setting actions based on a date and not benchmarks of the virus? That's pathetic. We talked about this last night, where when we first opened up, they talked about 30 days for schools to open. We're not going to open the schools until we go 30 days without an active case. Yeah, the numbers were low back then. Remember, hope is not a strategy, but they were hoping. Their strategy was hoping that, in fact, the numbers would go away. So because we set a date rather than, well, at that time we set the threshold, we set the benchmark. But when it became clear that the benchmarks ain't going to work to his liking or to the state's liking, because this virus is so volatile, um, he just moved the date. Now, we know this virus is active right now here in Hawaii. We know this. We know, I mean, hello. And how dare we even have a discussion about opening the school right now and setting a date? How dare we even talk about setting a date for opening tourism when we know right now this virus is basically getting out of control? That's not leadership. That is not leadership when you start. Now we're gonna try and make everything appear it's gonna be okay. You see, the ultimate goal, and we've said this from day one, Charles, from my first Facebook Live after the governor's press conference. I said this state was moving in the best interest of the visitor industry. Yeah, I said that from day one, and that's what we're doing. So right now, the ultimate target is opening tourism. That's the not the kids, not the kids. But we cannot open tourism if the schools are not open. All right, how does that look if you're saying we're safe enough to open up for tourism, but we're not safe enough to open up the schools for kids?
Ah,
So before we can open up tourism, we got to open up the schools for kids.
ah,
Now you see? So now it's real simple. Oh, we got to open up. I don't care when, as long as it's before September 1, because we're opening tourism on September 1st. I just saw that press release yesterday that the governor is still set on opening up tourism on September 1st. Now, how can you say that when we're going through a period of time that this virus is we're having more cases every day? Because you're not focusing on the virus, you're not focusing on health and safety, you're focusing on tourism. And while I can appreciate that, because we definitely need to get our people back to work, right now we're dealing with a virus that could very well be out of control shortly, and
Well,
that is my concern.
no, honestly, it doesn't matter. And I won't tell you the reason why. This is Charlie Yona's 1 cent. It doesn't matter because we can open up tourism. But if all the tourists that come in here are from areas that they cannot control their own virus in their own area, it doesn't matter. We're going to have to find a way to keep ourselves safe because they ain't bringing it under control. And I don't think we should do their job if I try bringing it under control here. We need to worry about our own. That's one. Two, I always looked at this from day one, and you've heard me say it when we had the LG on. What is the threshold? So I can understand why, when we hardly had cases, you close down, and now we have plenty of cases, and you like open up. What was that threshold to cause that kind of thinking? I would like to know. Maybe if you let us know, maybe I can buy into it if you give me a reason. That's all I'm saying. And you can give me Charlie Yona, take it or leave it. Okay, but you don't even give me anything right now. So what can I take and what can I leave?
You know why they're not giving you a reason?
Right.
Because they don't have one. There is
Exactly.
no rational, logical explanation.
Exactly.
Uh,
Exactly.
they have no what the hell?
Exactly.
Do you water your garden when it's storming rain, or do you water your garden when it's dry?
I go when it's raining.
Yeah, that's exactly what. There is no logical sense, you see, and that's the frustration I think for all of us is that
Yes,
uh,
Angie, it's blind ears and deaf eyes. I hear you, Angie. I hear you.
golly, I mean, I remember, I vividly remember when we asked um, the lieutenant governor, "What's the number?" Remember we talked about, and he said, "Well, if we get to 100 cases a day, we're going to have some issues. We're going to have some capacity issues. We're going to have some contact tracing issues." Well, guess what? We're there. We're past that, and
Yeah.
now he's freaking out. He's after the Department of Health, saying, "Hey, you guys got to step up your game. You got to step up your contact tracing." Well, the best time to prepare is before you need to prepare. We had 4 months. We had 4 months, Charles. We didn't have a plan B. We had a plan A.
Yep.
And again, I'm going back to Senator Mercado Kim's saying of hope is not a strategy. Our strategy was we hoped the numbers would go away, and that just simply didn't happen. And I think everyone was saying this. All of the general public was saying this. We saw the trends happening everywhere else. We knew it was just a matter of time. We know we're a couple weeks behind the mainland, 2 3 weeks behind the mainland with this virus. And we did really well with flattening the curve the first time, but everyone said it was going to come back stronger, and it did. And now, because we have so many people carrying this virus, now we had the second firefighter from the same fire station. We're seeing more and more clusters showing up because that's how this virus works.
Yep.
You take this virus home, there's a damn good chance your household is going to get the virus. And that's the bad part now, because the growth is exponential. The infections now become that 2.8, 3.2, whatever it is. In some cases, even up to 5 people. But the average is right around 2.83 people per infected person. So, and then, the old statistic, which I still think holds true today, is for every tested positive person, there's 10 more that haven't been identified yet.
Yep.
So that's just the way it works. And Maui today got approval although they didn't get the approval for implementing the inter-island quarantine, he did get approval to out indoor and outdoor gatherings, maximum of 10, no more than 10 people indoors or outdoors. That's gonna, I tell you right now, that is going to save Maui. That's going to be a big help to Maui. Honolulu closed bars now. Ball bars from tomorrow closed for 3 weeks. If you're a restaurant and you serve alcohol, you can still serve alcohol till 10 p.m., but after 10 p.m. you cannot serve alcohol. That doesn't do much for the congregation of the bars in the restaurants, but nonetheless, that's where Honolulu is at. And we'll have the mayor, our mayor, tomorrow night. Mayor Derek Kawakami will be on to hear what his thoughts are and what his plans are going forward. Um, be
Well,
interesting to see.
well, all I can say is, well, good luck, everybody. I mean, I hate to have this kind his poor attitude, but hey, you know, it's funny, and again, in a way, we've talked about this before because of our background is what it is. When you have a murderer that flees California or a group of murderers, you pull out all the resources if you know they're in Hawaii, right? You have all the resources in the world looking for them, and they get found. I equate that to we know get the virus in Hawaii, but the contact tracers just no can find them. I mean, I don't know what it is. I don't know if it's the training. I don't. That's why I posted. If there's any contact tracers out there, we want to give you the time, not to beat the crap out of you. We want to give you the time so you can explain to us lay people how you do your job. I want to support you. I want to know that if you need help, hey, if we can get you the help, we'll get you the help to do your job. But tell us what you do. Right now, in my mind, and there's really not that much up here, but there's some, I still get some cells left. I think to myself, you folks are behind a desk and on a phone most of the time. That's all I'm thinking. And from what I got from Dr. Berriman, is you have to be a people person with a degree, but you just have to be someone who can talk to people. Okay, well, we know they're Pacific Islanders where these clusters are. We know they don't like talking to people. We know that they don't like cooperating with government people. So I think you have to go beyond that. Just learn how to talk to people. You got to go beyond that stage. What do you do next? That's why we're asking, hey, come on our show. If you're out there bitching that we giving you guys a bum rap, prove me wrong. And you know what? I'll shave my head, bowl ahead. But come on the show. So everybody out there who watches can understand how you guys do your job. Because right now there's that one element. It's like a car, no different. It won't start if you don't have kakalina inside a tank. You don't have gas. Okay? You got to put the gas. This whole thing is not going to work. The integral part about this whole virus, other than the medical side, is the contact tracing because we're trying to find out where it's spreading, where it's going, where it's headed to. We're trying to get all of that. But right now, there's pleas out there for people to come forward. Let me ask you another question. Has anybody come forward yet? Probably not. Okay. So you can see how difficult it is. So are you folks resorting to other means to go and shake some trees? We don't know. I would love to know. And trust me, if you come here and you prove and you tell the whole world what your job is, I can guarantee you, you won't never hear another peep from Charlie Yon again criticizing your job. But until then, I do what I do. So hoping I get some of you so damn mad that you said, you know what, I take you up on your offer. I want to come on. Good. Good. That's where I want it to be. Come on. So you can let the world know how you do your job of contact tracing. Because for some reason, Hawaii is exempt from doing it right. I don't know. I think so because Korea, they get contact tracers and boy, they're successful. So they must be doing it wrong. So maybe you do it wrong, you hold down the virus. You do it right. No, no, no. The virus gonna run away from you. I mean, tell me how this thing works.
We
Aloha,
talked
everybody.
about
Welcome. This is
we
Charlie on and Mel.
we talked about 4 months ago. We talked about we told the Senate committee hearing, Senate committee members, the COVID committee, we told them our recommendation was still hire retired cops. Now, Charlie and I are not looking for a job. Trust me.
Yeah.
You know, I mean, if they'd let us give us a list, I would do it for free, Charlie. I'm telling you right now, to prove that we're right, and I know you would do the same. I would take off from my job for 1 week. You give me the list, and let me let Charlie and I go contact trace. I guarantee you would see a huge improvement. Now, again, it's not digging on the contact tracers. Listen, college degree with experience in the medical field. Why? Why? You know who would be the best contact tracer for in fact, my good buddy's on the call right now. I saw his name pop up, Eric. He was one of the guys that came in contact with the positive person. I had to bring him on. The state contact tracing didn't let Eric know. We did in our office. We figured it out. My point is this: why you gotta put that kind of requirement when if it's a specific Pacific Islander group? Why would you not want to recruit someone from that Pacific Islander group and train them and talk story with them and get information on what you need? Why you need a college degree? I don't get it. If you want the result, go get the result.
Well,
many of the police officers in Honolulu, let's just use Honolulu as an example, because that's where the big numbers are. Many of the police officers on Oahu right now have relationships with these communities, those guys that work in those areas. Why would you not reach out to HPD and say, we need your help? We need your help. This is what went down. This is someone that tested positive. We need your help in helping us identify all of the people that this person came in contact with. I gave Department of Health information that I got because my good buddy, dear friend of mine, is part of that community here in Kauai. I don't say that to brag. I'm just saying that the resources are there, and you need a college degree and a medical background to have relationships. I got to bring in the doc. He's in the waiting room.
Mm-hmm.
But anyway, I think oh, what's up, sexy? Big sexy.
Hello.
Man, I have never seen so many of our viewers so excited about our show.
All right. Well, why are they so excited about the show, Mel?
Because Dr. T was coming on. I mean, one lady said, gosh, I got my seat. I'll be there, front seat, front row. I mean, it's like they get so excited. Jesus, Christmas.
Well, we've been so busy at the office. I thought I'd make it home before 7, but I made it a little bit past 7, but it's been so busy because all the new cases and all the new problems and all these situations going on with the coronavirus. We're
Doc, we had you on a couple of times. We had you on when the numbers were low. You warned us. You gave us some possibilities, some probabilities. You told us what we could expect if we don't do certain things. And by the way, if you don't know who this good-looking guy is, he's Dr. Trpkovski, Dr. T. Welcome back, Doc. Welcome back.
Glad to be here.
So that's what we'll talk about tonight, Doc. What happened between the last time you were on when we were seeing some wonderful numbers and today?
What happened. So everything was fine. And I like us to be human and socialize and do everything, but we're in the middle of a pandemic. And the problem is, once we start letting our guard down, once we started going out and socializing more, meaning going to bars and wherever, if one person had it, it would spread to another and spread to another, and it spread like wildfire, kind of like we lit a match in a dry field. And now we're seeing the ramifications of that. So what's happening is, somebody will go out, they'll meet somebody or what have you in a bar, and then they'll go to a family gathering, and they didn't know they got corona, and then they'd end up going to the family gathering and getting everybody sick, or they'd go to work, and then at the workplace they would get a couple colleagues sick, and then this would just keep on growing, like I said, like wildfire. So now we're seeing 100+ cases a day. It's insane.
We were just talking about early on in this pandemic when we were still at the 12 and the 10s and the 9s and the 11s. And Lieutenant Governor Josh Green mentioned that if we ever once we start reaching the 100 cases per day mark, we got to start worrying. Well, we're there. And should we start worrying?
I'm worried, but what we found so far is that probably the people that are at higher risk have been avoiding going out or going to other places and catching the virus. Most commonly, the problem we're dealing with are the younger people catching it or middle age, and they're not really getting that sick. So from hospitalization standpoint, we've been pretty lucky. We're not getting a lot of people in the hospital. There's not a lot of people in the ICU. There are more people getting sick, but not that many are being hospitalized. So I think we're lucky there. But I think we're very unlucky due to the fact that our numbers are growing, and that can get into a very precarious situation because all of a sudden then we could get more and more people sick, and people that are high risk can get sick. And then that will be a catastrophe because then we will see an overflow in the hospitals, an overflow of people in the ICU. We're going to have to make decisions that are not going to be good ones due to the fact that we're going to have to make a choice. If it gets that bad and we have too many people in the hospital, then the doctors have to triage, meaning that they'll have to say, well, we have nothing else we can do. This person's just going to die, and we'll have to take that person off the ventilator and put somebody else on it. So I hope we don't come to that. Right now, what we're seeing is just a lot of numbers, but we're not seeing too many hospitalizations.
Hey, Doc, if we get to a point, conceivably, we can get to a point where the numbers get so, if we don't control it quickly enough, we could possibly get to a point where just by having it become an asymptomatic carrier, that we can basically infect people without people knowing they're getting infected, right? It's going to be a crossover.
Right, Charlie. I mean, a lot of the people we're having, I'm diagnosing so many people in my clinic. Many of them don't have symptoms. Many of them are asymptomatic, and they pass it on. They don't even know they had it. Why we're checking them is because they had exposure to somebody. So you check them because they had exposure to somebody positive directly, and guess what? They're positive. So you'll see like a whole family members, like a whole little family. One person will have symptoms. They're positive. You'll check the whole family, and they're positive too, but they didn't have any symptoms. So it's really scary. And then you'll go to work and you don't have symptoms, or you'll go someplace to the hospital, or you'll go visit somebody, and you'll end up passing the disease on to other people without unknowingly.
Now, let me ask you, I guess the question about reopening our Hawaii, it's now coming down to a point that because this virus is so rampant in all those states that usually visit Hawaii, we're sort of at that standoff right now. We're either going to get taken hostage because we're going to let them in, because there's no way of saying that we can let these people in when they're 100% virus free. There's no way of saying that,
right?
Because
no way.
It's just too hot. What do you think the state needs to do? I mean, you're on the front lines there, and you're basically crashing it out. What do you think we need to do? I mean, let's start with the professional side, the Department of Health. What do you think they need to do?
I think they're doing the best they can in the circumstances we're in, due to the fact that there are limited resources to what we have, from testing. I mean, there's other testing means out there, but we have limited supply. I mean, the antigen testing would help to do rapid screening, so you can get a nose swab. You're not doing the PCR deep one. You're doing a very light swab, and you're getting results in 15 minutes to see if somebody's actively infected. And that equipment exists, but it's really not available. I mean, I have it, but I only have very, very little. And so it's not to be enough to use an effective screening tool. So all we're really down to is using the PCR nose swab. And that PCR nose swab takes a day or two. We're lucky we're getting it back in a day or two, but in other places outside of Hawaii, it's taking them 7 to 10 days. So we're lucky there. But they're doing their best. I think from the Department of Health standpoint, they're really trying best they can to control this. I think the travel industry is really trying its best also, because they don't want to see us, failing at reopening the state. And then there has been stories and talk about, testing the tourists, especially the Japanese and others coming to the islands. when it's time to come, and they'll do some type of antigen testing or PCR testing, which would be fine. But I don't think our cases are mostly from the tourists. I think most of our cases are amongst ourselves, and that we let our guard down. And the small number that we had, we kind of let, kind of run rampant throughout the island, because we're not doing what we think we should be doing by washing our hands, social distancing, wearing masks and shields. I think we're just, in some instances, being very precarious, and people are getting sick.
So if that's the case, and I tend to agree with you, it's not coming from the outside. If it's here in the state, and it's multiplying at such a rapid rate, I guess I go back to the contact tracing again, because they've never been definitive about finding the origin. Because if you find the origin, that means that you pretty much locked up that chain, that link.
Right.
It's like a genealogy, right? You got your great grandfather to your great grandfather to your grandfather to your father. Yeah. You got that chain going, and you know where it's going. But it doesn't seem like the contact tracing program is proving that right now, because I don't know if they're equipped to do it that way, or it's just when they hit a roadblock, they say, okay, then you let us know if your symptoms change. I mean, it has to go beyond that, right?
No, I think a lot of it is also problems with getting correct information. Some people aren't very truthful in where they've been and what they've done, and that puts a stop right away to contact tracing. So if they're not going to be truthful, it'll come to a point where the person that they won't be able to figure out, how he got it, because he's not telling the truth. But I think they're understaffed anyways. I think it'd be very difficult, based on the volume of people we're having now, Charlie, is to be able to contact trace all of them. So like 120, how many was today? 124, 125?
Yeah, 124.
Yeah, so how are they going to contact trace 124 people? So that 124 people, they probably had at least contact with 10 or 20 people. So we're talking about checking, 2,000-3,000 people. How? Yeah. I don't think we have the resources to do that. I mean, I think shutting down the bars and certain places starting this Friday will help. And I think they need to really push across for family gatherings, because a lot of them, again, have been related to family gatherings where one person's infected. So, yeah, if nobody's infected in your family gathering, that's great, but you don't know. So one person comes over to a house for a house party, and everyone's relaxed and taking off their masks and, Hawaiian style, giving each other a kiss on the cheek and sharing food, on the table, Hawaiian style. Mm-hmm. That increases your risks. And so until this gets controlled, we need to just think twice about doing things like we used to do before. And unfortunate, that's just going to be difficult, because as I said before, we're humans and we like to do things. We're social animals. We like to hang out with our friends and our family. So that's why it's been very difficult. It's really hard to implement some type of control when humans really don't like to be in that situation, even when they're, looked at as a situation that's very threatening. But I think if they implement these changes over the next 2 to 4 weeks, we will see some changes. It will slow down, because that's the biggest association I've noticed. I mean, I like people to have the businesses up and running, and I like everything about small business. But unfortunately, we're in a situation where we have to implement these standards, because I think once we opened up, it's been like a month and a half now, we opened up this is when everything's falling apart. Over 2 to 3 weeks now, the numbers have going insane, and I think we're going to see numbers like this even after they close for another week or two, and then hopefully it'll start to come down in the next 3 to 4 weeks.
Maui the governor just approved Maui's request, Mayor Victorino's request, which I fully support, by the way. Gatherings no more than 10, indoor, outdoor, doesn't matter. I wish the governor would come out with a statewide mandate, because I think, you're doing it in Maui, but the activity is really in Oahu, doesn't help. Because, I mean, it's just, we got to control this virus on all islands.
All islands. Exactly.
Now,
Because travel inter-island. You're not. You're right.
absolutely. And Honolulu is our hub. People go to Honolulu for doctor's appointments. They go to Honolulu and they stop and grab a bite to eat or whatever it is, go shopping for a little bit, and it's a problem. Then they come back home and you get to a gathering, like you say, a funeral's been pretty bad as well. Any place that families come together and share the aloha and hug and kiss, it's causing a problem. Now, in sales and marketing, this is what I learned a long time ago, and I remembered it. I don't know why. It might not even be true today, but I think it is. When you have a new product for the marketplace, you got to really market that product until you get to about 2% market penetration. In other words, when your product is in 2% of the households, 2% of the market has your product, you're on your way. At that point, the stuff sells itself. Where are we in Hawaii? We have 124 cases today. At what point will we be at that market penetration where we lose control? Does anyone know that? Is that even, can you even figure it out? But at 124, we're basically tasking our contact tracers and everything else. Do you have an idea of what number that is? That's where we will probably lose control of this virus?
I think if we're getting 1,000 a day, yeah, we've lost control of the virus.
That many
number, 100 sounds like a lot, but it's a big island. I mean, it's a big cut state relatively. I mean, I think on Oahu, counting the military, we're like at 1.4 million, 1.5 million. That's a lot of people. So 100 people is only, I'm not good at math, but it's not that high of a percentage of the population. But 1,000 would be closer to 1%, right? If we're doing 1,000 a day, and then over the 2-week period, that number would just keep on doubling. Look how things were a week ago, right? We had a couple of days of 50, 60, then all of a sudden, boom, boom, boom. And then we're up into the hundreds. And that's probably tomorrow we might see 200.
Yeah. Honestly, with Charlie and I were talking, I had predicted that by the end of the week, we'd be at 200.
Yeah.
I hope that doesn't happen, but I'm just looking at the way the proportions of the increases, we're going to be close to 200. But okay, so you got two tracks. Number one, at 1,000, we're in big trouble. Hospitals, the beds, the ICUs, and all of this. But right now, as far as we want to stay ahead of it with our contact tracing and our testing. How you think 200, 300, 400 is we can handle? How many can we handle, I guess, is the real question.
Well, that's what I was talking about earlier. I mean, if we look at the ICU beds and the hospitalizations, I mean, the numbers are going up that are people being tested, but not that many are getting that ill that require hospitalization and to be intubated in the ICU. But that could change. All it takes is the wrong person in the right place, like in a nursing home or somewhere else, or someplace, as a large gathering like a church that have elderly people that have health problems, and then we could have a major catastrophe. But I think those people that are at risk, and that's what I'm attributing this to, are really being more cautious than everyone else. Because let's say if I had a lot of health problems and I was much older, I wouldn't even work where I'm working. I'd say, I'm going to just stay home till this passes. And I think a lot of people are looking at this, and I think they're all saying, oh, I'll be more careful. I'll wear my mask. I'll wear gloves. I'll do whatever it takes if I have to go out, or I'll have somebody go shopping for me so I don't get sick. So maybe that's why we're not seeing more and more elderly and more people with other problems, other health problems getting really sick and hospitalized. But I don't know what difference that would make if our numbers increase. Maybe we will see more people getting sick and hospitalized. Remember, what's also very important is the amount of virus, the viral load that you get exposed to, okay? So let's say somebody passes by and they have it and they breathe really heavy by you, and you might get exposed to the virus and you might get sick, but you might not get that sick because your body's not going to mount a very strong response due to the fact that you only got exposed to a small amount of the virus. But if somebody was like, coughing on you, breathing, talking to you for an hour, and they had it, and you got a lot of virus, well, then you have an increase of getting very sick, even if you're young and healthy. And so I think people are being more cautious. People are not spending that much time with each other as much as they used to with strangers. With people they don't, what they do know is where they need to be more careful because they're thinking, oh, this is my cousin, this is my brother, they're fine, this is my father, but it's not the case. We don't know, so that's the hard part. Living in a small house or a large house wherever there's a lot of people increases the risk. If we do a gathering, increases the risk. So I think everyone needs to keep that in mind. I mean, I'm seeing, because we had, so many people that are positive, and when you have so many that are positive, every workplace, every family, every place that people think they've got exposed or directly exposed, they come in and they want to get tested. So we're going to be testing even more people, and the more people you test, the more people we're going to find. And so I think everyone as a society here in Hawaii and in the world needs to think a little bit about what we're doing, even though it's not something that we want to do, but it's something we have to do. We really have to do our best to contain this because it's going to destroy not just people that are, not, getting sick, but it's going to destroy the whole economy of the United States and the world. I mean, I think it's also making us look like a very weak nation. The United States now looks in the eyes of the world, they can't even control an infection, where a lot of people are showing that they are controlling the infection. Here we are with all the resources and all the money supposedly we have. We look ridiculous.
I was just thinking, and I apologize while you were talking, I was kind of giggling in the background because you talk about these numbers going up, right? So basically you have a bunch of vials that's got to be tested, right?
Yeah.
And then from there, you get maybe like 5-6% of those vials come up positive, right? And this thing is going on a track day to day, got these numbers. And I can just imagine tomorrow when they got 10,000 vials over there, a group of lab people, they're taking bets. Okay, how much you want to bet? We got 300-400 today. And they're all looking at these vials like, holy crap, I wonder what's going to happen. Because that's basically what's happening now. They're calling it because they said, in this group of vials, we definitely got a lot in here.
Yeah.
I think that's how they're calling it right now.
I think it is about 4 or 5% of the tests are coming back positive. I'm looking at our numbers. That's what it is. So if we test 100 people, 5 or 6 are going to be positive.
Right.
And yesterday was at 6%. Today was about 5.6%. That's of all the based on a test that these results came from. 6%, 5.6%. That's a lot. That's a very high ratio.
Yep. I agree. Those are the kind of numbers I'd expect based on my statistics in the office. I mean, it's really sad because a lot of people that do get the illness don't want to pass it on to a loved one or into anyone, but they just don't know, and that's the hard part of dealing with this is that it'd be really difficult for me. Say I was positive and I didn't know, and I gave it to somebody I loved, and then they got really sick or died. I'd be devastated. I'd always feel guilty that somehow I should have done something different in the way I was, acting or however I was, living my life, that maybe I could have prevented, the sickness of this loved one or their death. So those are kind of things you need to put on your plate and think, if I'm not careful, I'm younger and I'm healthy. And if I get it, I'm not going to die, but I might accidentally give it to my grandmother, to my grandfather, to my father or my mother, so we need to remember that in the back of our minds, even though people who are younger and want to go out and have fun, we have to remember that we live our life and we share, space with our family and other people, and we don't want to get them sick. And I think most people don't do it consciously, but subconsciously, they want to enjoy life and they're not thinking really about everything,
I think if everything was made in heaven for us, what we need to follow. We talked about it last night, a three-week shutdown period. But the thing is, in order for it to work, and you have to agree with this, Doc, but you let me know what you think.
Okay.
In order for it to work, everybody has to march to the same tune. Because when you got people doing whatever they want to do, and yet you have the discipline group, it would be nice to know, are these infected cases coming from the discipline group or the group that just didn't give a rip? Because if it came from the discipline group, then there had to have been a crossover at one point. And I think that's where you want to take the population and start splitting it up and isolating it. It says, okay, you folks haven't been touched. You need to be isolated. You haven't been touched. And start working towards until such time you can surround that group that is infected and try weed it out from that point. But if people don't march to the same tune, I don't think it's possible to get down to the bottom of it. Doesn't sound like it.
I agree. It's going to be really hard, Charlie, to get this controlled, because realistically we can't do that. I mean, too many independent people, too many things that they want to do on their own. We can't control. All we can do is try to talk to everyone and explain to everyone and tell them, hey, I mean, the only medicine we have right now for this illness is social distancing, washing your hands, masks and shields. I mean, that's all we have. There's no really anything else to prevent it. When the vaccine comes along, we still have to do that. And then hopefully the vaccine will help and we'll get a decrease in the numbers and we'll be able to control this in some way. But it is what it is. We have to adapt to what's happening around us, or we're gonna be destroyed. Just like anything. If you don't change, only the strong are gonna survive and the weak are not. Because if we don't follow any kind of guideline to try to control this, we are going to get more sick and more sick as a nation and a state, and we're going to have more and more problems. I mean, we have to look at it from that aspect. Maybe the state or maybe the United States needs to look at it as a larger crisis than they are and start implementing maybe more laws into controlling people wearing masks and social distancing, or maybe even getting more specific about contact tracing, or getting more strict about travel, and saying, hey, if you travel, you got to get tested, or they got to do something different, because this is out of control. It's only going to get worse unless we do more and more to protect each of ourselves.
Well, we copy the countries that have been successful. We've been talking about that in the last couple of weeks quite a bit. That there's other models out there that are working, and unfortunately, America, civil rights is a big issue. People complain. We had a big demonstration today out right at the county building. No masks, no social distancing, protesting for child safety, for against child sex trafficking and all of that. Great cause. They're out there trying to protect our kids, but none of them wearing a mask and none of them practice social distancing. That's the kind of behavior that's going to get us in trouble.
Exactly. Yeah, exactly.
And I have a question from a viewer. It says, why would an ear, nose, and throat doctor give a patient a diagnosis of no virus if no test was administered?
I don't know. Maybe dogs they've trained. They're training dogs to smell coronavirus. Maybe
Yes.
Superpower that no one else has.
That's why we fill up the seats when you're on, Doc. I heard that actually from other people as well. In fact, when my daughter came home, this was before Corona blew up. I mean, it was just starting. She came home from Oregon and she got sick. Look at, there goes Charlie. There goes Charlie. And so she came home and she was sick. She had, and then when she went back to Oregon, she started getting a sore throat and fever. And she went to the doctor, to the urgent care. They didn't test her for, Charlie, what's wrong? They didn't test her for flu, or they didn't test her for COVID. She probably had COVID. She's young. She's healthy. She's all good. But we'll never know.
Doc said about that, they're training a dog to sniff the coronavirus. I was just thinking, man, it'd be your luck. You pay $5,000 to train a dog, and you end up with a dog that can't smell anything. I'm sorry.
This guy, he does this every so often. He does this, yeah, about 6 or 7 times a freaking night. That's how often he does it. Look at him.
He's still, but they really are. They're training dogs. Seriously,
No,
No,
you
no,
know,
we believe you.
listen,
give it out. So
they
what we
train dogs.
here, start sniffing everybody, and then we'll isolate them. And then if we had like a whole pack of them, maybe 100 of them, what do you think? Maybe in Hawaii, you guys can chain the chickens. You could train the chickens to smell it up.
I mean, I can see the big Matson container reversing up into the park, and just where all these protesters are, and just and the mayor comes out and he says, "Release the hounds," and the dogs just go. And when the dog comes across a COVID positive, he stops.
Right.
And then we can go there, and Dr. T and everybody else can go there and shove the thing down their nose. And
Think that nose. You got it.
Yeah, I think we ought to do that. I mean, I think that's a damn good idea. Tomorrow we have the mayor on. I'm going to see if he's open to doing something like that.
Yeah, we can get somebody to train dogs. We got a lot of dogs, a lot of hunting dogs. Get them dogs, train them, smell out the corona.
Did you see the beagles that can sniff out termites?
Yeah, I mean,
they're on Oahu. They're on Oahu. It's incredible.
Let's train them to smell the COVID, and then we got a whole new task force. We'll put them COVID task force.
Yeah, let's do that, Charles. We'll find a couple of beagles. Release the hounds. Brand new T-shirt. Release the hounds. Okay. So, Doc, in Honolulu, I mean, I think you mentioned it earlier. You touched on it. A lot of your patients are asymptomatic or mildly ill, and they're coming in because they may have come in contact with someone.
Yep.
Is that the majority of the patients that you're seeing?
The majority either have contact with someone directly, or they have like a runny nose, sore throat, or loss of smell. Very rarely I'll see these very, high fevers, but they come in too. But it's mostly very mild symptoms, barely anything you would, worry about. But now because it's Corona, you worry about all those things, from runny nose, nasal congestion, loss of smell. If somebody came to me last year, I'd say, okay, you got a viral cold, and big deal. But now we worry everyone has Corona, so we test everyone.
Hey, Doc, let me ask you: when these people come into your office, and until such time you test them and they come out positive, what kind of procedure do you go in? Because they came in, they must be touching door handles, they must be touching everything from the sun. When they come into a hotel lobby, do you notify the hotel that, hey, we had a positive person come in, or what do you do?
Well, the hotel is almost semi-closed anyways, where we're at. They're only seeing airline attendants only and pilots. Otherwise, it's closed. And it's a separate entryway to go to our office. You can't go through the hotel lobby anymore to get to our office because they're semi-closed. But we disinfect every day. After every patient, we disinfect the room. So we wipe down the whole tables with that Clorox. We wipe down the chairs. We spray a special disinfectant in each of the rooms. And at the end of the day, we have cleaning crew comes in and disinfects everything again at the end of the day. I really think it's a lot harder to get than touching a surface or it lingering in the room due to the fact that, we have 40 plus staff where I'm at, and we have had over 100 positive cases. None of us have antibodies. None of us had the coronavirus, and I'm always knocking on wood because I don't want us to get it, but none of us has had it yet. And then we're just being cautious. We're wearing gloves when we're touching patients. We're wearing masks. We're wearing shields. We're wearing PPE, but we don't spend a lot of time with them either. I think that has a lot to do with it also. Only the providers do the swabs, not the nurses. And so I think that's part of it too. So I think it's harder to get than we think in quick for, just passing by somebody. I really think it takes a longer time to be exposed, a higher volume of virus, in the right circumstances. So, think about it. I have not seen not one flu case in so long. And I test for the flu regularly. So if somebody has body aches or a fever, I'm testing for the flu. And then I'm sending also the, swab for Corona, but I'm not finding any flu cases since March. And I used to see flu cases regularly, even in the summer. So
Well,
I
you
think what we're is by wearing the masks,
right.
distancing, we're doing something. It's helping. But I think people are letting their guard down when they're going out to a bar and what have you. You know, they're talking, hanging out with their friends. If they're single, they're trying to hook up with, you know, a guy or a girl, and then they're, you know, passing it amongst themselves unknowingly. And then it goes home or goes to the workplace and you're getting everybody else sick.
You know, we're just talking about this the other night as well. You know, before all of this, I would get sick because you know I had pneumonia, the whole works. You know, flus were, but you know, ever since doing this mask and you know sanitizing and doing it religiously, haven't got in touch yet, and I'm happy for it. You know, so we must be doing something right.
Yeah. So yeah, look at that. That's what I'm trying to tell you. So maybe in the future, even when the corona goes away, we should still continue to
Yeah.
be a little bit more cautious. And maybe it's just the washing hands, maybe it's the mask, maybe it's everything. But it's really showing me that I haven't, like I said, I barely see that much other illness nowadays compared to, you know, pre-corona.
Yeah.
Well, I think a big part of it is those shields that you have that you wear.
I agree.
Yeah, I agree too. That box just came in, by the way. I just got the
All
box yesterday. We have 50 left, by the way. This is the last order. So if any of you want to get those shields that Dr. T uses in his practice, this is going to be this is the six. This will be 600 shields, Doc,
Wow.
on Kauai. Thanks to you.
Thank you.
And if you guys still want, we got 50 left. That's it. And you just anyway message me if you're interested in a shield. I don't want to waste time on that. I have a question on it. Oh, I'm sorry.
Is we just made child shield. I want to show you the child shield.
Oh, Doc, thank you. Thank you, Doc. Now I'm going to get 1 billion requests for child shields now.
Yeah, I mean, we took the same shield and we shrunk it for kids. So it's the same shield, but it's just about half the size. And it's much better due to the fact they'll fit their face much better. You know, look, here's the old shield. And look, this one fits right inside. Here's the new shield. It's for, like, I'd say age groups from, you know, age 5 to age probably 11 or 12. Now, even women, you know, especially a lot of our, you know, women that live here, that are, you know, Asian descent, this fits them too, you know, but this is designed for kids. And so I have these as many as people want. I can, you know, ship and they can buy them at the office or we can send them to Kauai. But I know people are going to want these because they're all worried about the kids going back to school.
And I know. For you guys out there, you know, for you guys out there with small heads, you get the smallest shield.
Or you can take the big shield, put them in the micro for 14 and a half seconds, and it shrinks them right down to the kid size. Just kidding. Just kidding. Is that prototype? Did your ones for the hat ever get done?
They're coming. Those are, I don't know why. Our partner is the guy who owns the plastic factory. Okay. And I told him we need this and we need that. And we came up with the design for the hat trick really early on, the one that attaches to the bill of the hat. And he pushed this first because you know what? He's really thinking about the kids because the kids are going back to school. And I think we need to focus on them due to the fact of school starting. But the hat one's coming. It's coming. But this one they felt was more important. So they pushed this one out instead, which is, I can't argue with them, but I think the hat one people will want also because you can wear your hat and put the shield on and you're much more comfortable.
Yep.
How much are the kids shields?
Same price. They're the same price. Everything's the same price.
You know, I went online. Somebody went online and looked, and they raised their price. You know, for the retail online, it's for the shields. It went up to, I believe 50. It went up to $14.95 online.
Yeah. The manufacturer. See, I'm the innovator. I'm the inventor together with my brother. But he's he does all the other aspects of it. He's doing the sales. He's doing the manufacture of it. You know, so. Yeah, he told me he was going to raise the prices, but it becomes even more expensive if you order it from them.
No, you can't. I was just the reason I brought it up was I wanted to know if that was going to affect the price from you.
No, he's giving me because we're partners, giving me a price, of course. But I still got to pay for them and I got to sell them. But I think the price is fair because if you think about it, if it's under 10. around $10. People are selling those stupid cloth masks for $8. I've even seen them for, and then the plastic ones are selling for $8, $9. The ones from China, and they're no good.
Yeah,
So
well, we sell them. We sell them for. We sell them for. We sell them for $12 here on Kauai to cover the shipping and everything else. It makes money.
That's a very
Yeah. So if you want to get it for $9.99 or $10, go fly to Honolulu, go pick it up from Dr. T.
Pick them up.
Yeah. Go say hello, take them a nice cup of coffee, and you can pick up your mask.
Yes.
For $12. So yeah, we definitely will entertain. If you guys want the child ones, let me know. We'll take care of it. But they come in a set of 100, so we need 100.
Yeah.
Because I don't want to get stuck with masks in my house.
No.
But anyway, the question that was asked was, there's a lot of talk about, if I come in, doc, I come in to see you and I get tested, I test positive.
Okay.
I go home, I quarantine myself, I isolate myself for 14 days, and then I go back to work. And then let's say I go, before I go back to work, I come back and see you. I said, doc, I want to take another test before I go back to work. You give me another PCR, not an antibody, but a PCR. That thing goes to the Department of Health. If it's positive again, do I get counted twice? Do you know the answer to that?
I don't know.
Okay.
Because I recommend post testing, because the Department of Health, they're trying to conserve resources. But if somebody comes to me and they need to go back to work after they were positive, and they want me to give them a letter that they're free of illness, I won't give it to them unless I've retested them, because I don't want responsibility on my head. And I know the Department of Health talks about, well, some people are just shedders and they're not infectious. I don't believe that. Until somebody proves that to me, then I'm going to stand my ground. But I don't know if they're counted twice. Maybe they are, but we don't have that many people coming back. I'll ask them, come back after 2 weeks and we'll retest you. I'd say maybe it's only 10%, or maybe 15% of the people come back and get retested. Now, maybe more will come, but if they ask the Department of Health, because the Department of Health takes over after I test them, and we call the Department of Health and they're positive, and they'll say, okay. And then they kind of guide them through the 2 weeks. And then the Department of Health say, you're fine, go about your business. It's been 2 weeks. But I personally, even if it was me, if I was positive, I would 2 weeks later check and see I was negative, because I work with people. I don't want to go to the office and get everybody sick. I don't want to go get patients sick, So I think they answer towards that, but that's me.
Can you expand on what you just said a little while ago about the shedding and the infectious part?
Well, so if you look at statistically all the people that have gotten the virus and then they say they got retested, probably 90-some%, maybe all of them, 95%, 90 or more, don't have the virus anymore after 2 weeks. But there's a small percentage, maybe 5%, that still have the virus in their nose, that can still spread the virus, and it's my belief. And because if it's active virus in their nose, they can still get you infected. So some people take 4, 5, 6 weeks to become negative. So if there's a small percentage of people, let's say it's 5%, that's a lot of people then that are out there thinking they're safe and going back to work, say in a nursing home, or going back to work in a hospital, or going back to work somewhere that is a riskier place than most, and then they're passing it again to everyone else. So I really think we need to take a different stand towards retesting. Even though our resources are limited, we should come up with a better protocol for that. And then another thing I want to touch upon are essential workers. So I'm getting more and more frustrated because a lot of people are coming from the mainland, from Texas and other states that have a high rate of COVID. And they'll say, well, we're an essential worker. And they're going right about their business like it's no big deal. I mean, I came across a flight attendant a couple weeks ago, and they were out partying, going to all the bars, doing whatever they want. Well, I go, how can you be doing this? Well, I'm an essential worker. I go, well, that doesn't make you go and do whatever you want. And so we got to come up with a better protocol for essential workers. Essential workers need to come in and get tested, and then maybe they should go about their business. If they're essential, still get tested. But some of them aren't getting tested.
Well, go to the hotel. Go quarantine. You go to work, and then you quarantine if you're not tested. I mean, that
Nope.
could be. Yeah, I know that it's not happening right now, But
workers
again, the exemptions, doc. These guys are giving away exemptions like it's Christmas, you know.
notice more and more. I mean, it's more and more essential workers. And I said, what's going on? Well, we need them. We need them. That's fine. Test them. Negative. Okay, if they're so essential, but you can't just let them go about and do their business. You know.
You know, I think what's happening with the program as it is right now, that's why we have more non-compliance. Because when you bring in people like that and you don't test, people are questioning. How can you be so sure just by looking at them that they're not infected or not? And
They
so
need to go
that,
to the throat doctor.
yeah,
That me about earlier. He could tell. Or they need that dog, the Corona dog. But they get the Corona dog at the airport, right? They're sniffing for drugs. They're surfing everything, and they're sniffing for Corona.
well, they got this special dog that down at the airport because they sniff, right? So if
Yeah,
they sniff for drugs, the dog will sit right by the person and they
yeah.
do the search and they find the drugs. But if they sniff and a dog comes by you and craps on your leg, that means the dog found a bomb.
Was that what we're gonna do for Corona? The crap on the law.
I don't know. It's the thing about it is I'm trying to see what the messaging is because it seems the health department, the whole messaging program. I mean, I look at Korea, I watch NHK late at night in Japan. They got an absolute unreal messaging program. If they want their population to buy into what they're trying to achieve, the messaging has to be just right. And I think we're lacking that right now. We're not doing it right.
Yeah, we're not doing it right. I agree. I mean, we need to get a little bit more stricter. Unfortunately, this is what we're going to have to do. I don't like it. I mean, who likes to change their lifestyle? Nobody. Everyone's uncomfortable with this. We all have to just be uncomfortable for a little bit longer and then let it get under control. Then we can go about our business. But if we don't restrain ourselves, I'm serious. This is going to be something we're going to have to deal with it more and more. It's just like everything in life. Everything that's difficult has value, right? You know, I mean, if school was easy, everyone would go to school, go to college, and do whatever they're. It's not. It's hard. You got to sit down. You got to study. You got to commit. It's just like this. We all have to focus and commit to being the best we can to control this, so we can go about our lives in the next 3 to 6 months. If not, this is going to go on all year. I mean, we're going to end up going back into the Stone Ages if we don't change anything.
Now,
it's going to.
We had a group of professionals last night. Doctors, teachers, parents.
Yeah.
I don't know if you got to see that. The one thing that I was hoping that I could hear from, and maybe it's time to ask you about this. How does the classroom get set up? I mean, they're talking about 6-foot distancing and all that, but we're dealing with a different set of dynamics now. We're dealing with students. We know how resilient they are, but at the same token, nobody's talking about teaching them proper disinfecting procedures, because when they leave the campus, they're going home, and if they got it, they're going to take it home with them. Or if they got it from home and bringing it to school, what can you share with that? What's your thoughts there, Doc?
I've thought about this a lot, and I really think, so here's the problem we have. School serves two purposes, right? It's to educate the youth, but also allows for the mothers either to have a break or work. I mean, a lot of times I've heard the saying that mothers, came up with school so they could have a break. But that joking aside, so I think the best solution would be online school. Everybody reverts to an online program. Kids will have to find a way for the next year to get by, and then the virus will get under control, then we start going back to normal. But the problem we have there is, what do the parents do? We live in a working family. We don't have, like it used to be when I was a kid, my father only worked and my mother stayed home. That doesn't exist anymore. Everybody works. And so who's going to take care of the kids? So that's the problem. That's the dilemma. Maybe the state needs to set up some kind of solution where instead of giving us money for whatever, set up some kind of program that people that aren't working, they can watch your kid, something different, something so that the kid's safe and he's at home, he can do his online classes, and then the parents can go to work and take care of business and come back. But now, if they can't do that, well, what else can you do? Well, in the school, a lot of them are doing the staggering, right? Half the students come one week, the other half come the other week, which is good because that's a lot less students in the same space, right? And then I've seen some pictures where they're actually putting dividers in front of each of the desks, or some kind of plexiglass enclosure or something. Well, that'd be good. And I think if they made the children's wear the mask and even wear a shield, even more so. And then they're going to do hand washing and everything else. But I mean, the safest thing is they stay home. But I don't think that's doable unless we had some other thing in place so that we could watch the kids, you know? I mean, if the economy keeps on going in this direction too, there'll be no more work anyways. And so the moms or the dads are going to have to stay home because they're not going to be working because there's nothing to do. So maybe there's the solution too. If the economy gets worse, nobody's at work, so kids can go online school. I mean, I don't know what the solution is. I'm trying to be funny, but it's not funny because
you know, Doc, but we're at the stage now, you know, I don't know, you know, we tried, I mean, we meaning the community, the leaders, everybody try to educate, inform the people what you got to do. We were doing so well, and then people got complacent. Now people running around like it's nothing, and now we're seeing all these clusters popping up. We're seeing kids getting them. We're seeing schools getting them, and people not getting the picture. So now the government got to step back in and pass laws, reduce the size. People getting pissed off because their rights are being trampled on. But yet this is so serious. This is so damn serious that, you know, and again, the state, we have a beautiful beach over here, Pole Holly Beach. The state shut them down yesterday indefinitely because the last 3 weekends, over 1,000 people camping, congregating, big tents, big party, paina, kanikapila, everything.
Yep.
Shut down. And that's what's going to happen if we don't get this thing down. If we don't do it for ourselves, they're going to do it for us.
Yep.
And I have a feeling that you're gonna see the enforcement get tighter. You're gonna see people getting arrested versus cited, because I noticed the change in the tone of the governor. He actually sounded like a defeated man yesterday at the first time I heard him. He just sounded beaten, and I can only imagine the decisions this guy's got to make and the stress he has. But all the mayors now are starting to get tough because they're realizing the danger that this thing poses, and we got to start being disciplined. Doc, I have this question. I'm going to read it because it's, oh, I'm sorry.
I agree. I said that's all.
Okay. It says, question for Dr. T. I hear that patients who recover from COVID-19 lose antibodies in the weeks and months after recovering from COVID-19. So is it possible to have had COVID-19 in January, but tested negative in June with the rapid test? Just curious if we really know how many people had it months ago.
So I don't know that for a fact, but probably. I don't know how long the antibodies last. I know that I have evidence that people who are in these highly contagious areas, like in New York and other states, that the physicians that are seeing patients actively in the hospital, they'll get sick, they'll test positive, they'll quarantine, test negative, then go back to work. And then maybe 3 months later, they're sick again and they're testing positive again. So we're thinking that the antibodies maybe only last 3 to maybe 6 months at the most. And so if that's the case, of course, yeah, the antibody test is not going to help us. We'll probably not see a positive after so many months. But everybody's different. You know, antibodies aren't the only way that we protect ourselves from the virus. There are other different things that we don't pick up when we do blood testing. And so that's what the current new vaccines are working on, not only antibodies, but also stimulating other cells that could help, fight the virus.
Hey, Doc, we had someone come on, you know the video that's been going viral with the frontline doctors with the hydroxychloroquine, zithromycin, and zinc. What's your thought about that protocol?
I'm not a controversial kind of guy, but if there's no harm in taking certain medications, I'm for it. But some people get really sick from the hydroxychloroquine. And so I think if we just randomly say take hydroxychloroquine and then the wrong person will take it and get sick and maybe even die, well, then that's no good. first thing they teach us in medical school is do no harm. Don't kill anybody. You know, try to help them, but don't kill them. You know, so here am I trying to prevent something you don't even have, and I'm giving you hydroxychloroquine, and you get really sick, and I kill you. Well, what was the point of that? You're not even sick. Even if you got sick, you might not have died. You know what I mean? You might not have died. So I think we need to keep that in mind. I think certain vitamins, multivitamins can help. Certain things we do, healthy living, will increase our immunity. Certain foods, living healthy, eating healthy, increase our immunity. Exercising increases our immunity. Sleeping like you're supposed to increases our immunity. Bad habits like smoking or drinking too much, none of that helps us, you know? So if people do these healthy living, they're increasing their chances of survival and they're decreasing their risks of getting the virus, right? So those are things that are safe. But I don't know about, you know, hydroxychloroquine and everything. I really don't.
You know, and the reason why I said that, and again, because my brother went under that regimen, and they discontinued it real fast when he started to see his heart starting to act really weird.
Yeah.
So if they, from what I found out, just based on his reports, we were able to get the reports after he passed away from the COVID, is that one of the medical recommendations was, or I guess you put in, you cite certain things that was happening during the period of time when they gave him the meds, that it almost seemed that if he kept him on the meds, that probably would have killed him. So that's why he got pulled back right away.
Yeah, I don't know, Charlie, and I'm sorry about your brother, but yeah, I mean, we don't know. That's why.
Yeah.
I think, again, do no harm. You know, do your best to help the people. If you're not sure about something, don't do it because you could cause more harm than good. But I think we're going to get lucky in the coming month or so. We're going to have, you know, some good news more about the vaccine that they're already trying, and I think that's going to help people get a little bit more confidence. I think implementing what Ige said in the Department of Health and everyone about, you know, about shutting down the bars and what have you for the next 3 months, that'll help. And then if we're smart, we'll all be smart and kind of watch and help each other by social distancing, washing our hands, wearing masks, wearing shields, whatever it takes to prevent us from getting infection, so that we can go back to living a normal life, hopefully in the next 3 to 6 months.
Awesome. Well, Doc, thank you again. We appreciate you giving us an hour of your night. I know you're a busy guy, and you kind of want to unwind and relax after a day at the office. Golly, I appreciate what you do for so many people. You know, I'm sorry, I'm reading that little. Well, Eileen, a friend of mine, just messaged me that she's gonna donate $500 for kid shields to be donated to kids. Oh, I get emotional. They can't afford it.
Wow.
And I don't know how we're gonna do this, but we will. She's Venmoing money right now.
Wow.
Whew. And a lot of kids can't afford it. And she's putting out a challenge to you guys. A case is 100
shields.
100 shields. And with the shipping, it's about, it's close, it's 1,100, whatever it is, $1,200, depends. But she's putting out a challenge. You viewers, you guys donate the other 500 and we can provide free shields to 100 kids. So, that's the challenge. You guys watching, $10, $15, $20. Nobody makes money off of this. Eileen, thank you so much. God bless you. Just like that, 500. That's what it's going to take for us to get through this. So Venmo, Mel Raposo, will get this case over here. I'm not even going to sell this to anybody until we fill this first case.
Wow.
Once we get this first case of 100 out to, and we'll figure out a way to get it to the kids that need them before August 17th. Once we do that, we'll open it up for everybody else.
Well,
it's cool. It's cool.
Thanks, Doc. Well, no, but from my end, I mean, I'll donate 100 shields. My cost. Don't worry. I'll cover it all. I'll send 100 just from me. Okay. But there's a lot more kids that need it. There's a lot more people that need to be protected.
Well, she just got a match of 250s. I freaking feel like we're doing a telethon without entertainment.
Yeah. No, we're the entertainment.
Well, Doc, thank you, man. Doc, thank you. It's 100 from Dr. T.
100 from me. 100's coming from me. Okay.
And we got another 100 coming. We got another 100. Rhonda will go to Honolulu to pick it up.
Okay.
So
we got another 400 right here. We got 200 from Mila, 100 from Diane, 100 from Sarah. In addition to the 5, that's 900 right there.
Okay.
Dr. T.
200 coming to Kauai then.
Wow.
Look, I just got another 100. I just got another 100. I just got another 50. I just got another 20. I don't know. It's coming in like a lot.
Wow. Well, that's amazing. I'm glad there's so many good people on Kauai. I miss all my patients and I miss all my friends on Kauai.
They miss you too, Doc. You got to know that. They miss you too. They're
All
always
right.
asking when you coming back. And
Well,
I said, well,
You know, I just know that there's a lot of parents that are stressing right now. They don't want to send the kids to school, and they can't afford. You know, you got 4 kids, you can't afford $12 a shield. You know, and man, thank you, Doc.
you're welcome. You're welcome. That's
Yeah.
nothing. I don't mind. I'm glad.
And I don't even know what the hell it's going to add up to. You know, hopefully it's 300 shields we can give away.
Well, you keep track. 100 shields on, or Rhonda can pick them up, whatever you want to do. Okay. But you got 100 from me, 1 box from me. And then we'll see, you know, how many people, you know, I mean, it's important that we got to help. I mean, I've donated over 500 shields, adult shields, to the local hospitals in Oahu. I did that right from the beginning, but we just got these. So I'm happy to send them out to Kauai.
okay.
Whew. Well, thank you, Doc, and thank you all of you. Golly, Jesus, I thought we was going to take a week to just match that, but it looks like we're probably going to have a few hundred shields. That is just amazing.
Amazing.
You know, these kinds of things happen, Doc. It's just nothing happens by accident, man. You're a blessed man. You bless us, and we love you, man.
Well, thank you, Mel. Thank you. I'm glad we had the time to meet like this again, and I'm glad we're able to help other people, and I'm glad we're able to spread the word and help people try to be safe. I wish I could decrease their anxiety about the problem, but I think they need to be a little anxious so that we are more cautious.
Yes, exactly. Exactly.
We need to, you know what the Japanese have this saying called gambate,
Yeah.
which means, you know, toughen up. We got to toughen up and survive this so that we can live lives normal again. If we don't do this, it's just going to be going on and on like this for a long time.
Yes.
Don't toughen up and harden up and push and try to, it's just going to be something that's going to slowly eat us away. And as we notice, a lot of the small businesses are going to suffer. People's livelihoods are going to suffer. The hotels can't open. All these things that we relied on for make a living are not gonna be here anymore. So we have to gambate.
That's a new shirt, Kirk. That's a new shirt, gambate. You know, this show is a blessing, and Charlie and I appreciate all of you guys. I mean, you know, we did the shirts, $6,200 to Hawaii Community Foundation. Look, I'm looking at these things still coming in. 100 here, 200, 100. I don't even know what the hell it is, but you know, I have been, and you too, Charlie, I know this for a fact that you have been hearing from so many parents that are scared, that are concerned, and just so confused, not knowing what they're going to do come August 4th. And, you know, thank God they extended it to the 17th. And I'm hoping that they extend it even further, because I don't think we'll be ready for school on the 17th, but whatever, that's beyond our pay grade. But again, you know, I want to thank you, Doc. I want to thank Eileen for starting this damn ball rolling.
Yeah.
$500 donation with a simple request to match, and it's I don't know what it is.
It's over 2,000, looks like.
Wow.
So,
Wow. I love it.
You know, I mean, if you guys want to donate to the cause, I'm going to do this. You know, I never thought we'd do it, but I'm going to do this. If you guys want to donate to this cause, this is for kids, face shields. Dr. T has generously donated one case. That's $1,000. $1,000. Eileen, 500. Bridget, another 250. And all of you, I'm not gonna name all our names tonight. We will definitely let the world know. But we're gonna be able to put several hundred kids in a shield before they're ready to go back to school.
Good.
If you guys want to donate for shields, make sure if you Venmo me, Mel Raposo, just put in the comments donation. And once we get that squared away, we will open this thing up and sell these things to the kids that can't afford it.
Mel,
Yes.
can you, for the people, can you put down your Venmo, how they can get to you? A lot of people want to know.
It's just Mel Raposo. That's it. Let's go to Venmo. If you don't have Venmo and you want to donate, just shoot me a message. I'll send you another way we can get it done.
Okay, now the account is up to 2,600.
I can tell you right now, Mona Dotari Agor 200, Gemma Souza 100, Marlene Duarte 20, Sabra 50, Shelly 100, and this thing is coming in a lot. And
Thanks, Doc. Doc, a lot of it is, you come on the show, you give up your time. You're a frontline worker. We would have never heard about these shields if it wasn't for you telling us, because we never thought about it. But then remember we had the discussion that when you fly on an airplane, because the way the air processes in close quarters,
right.
You got your mask, you got your shields, because everybody thinks that we're going to inhale the virus. We can also get into our tear ducts.
Your eyes.
So because of that, your eyes. So because of that, Doc, you've been very, very vocal about, wearing the shields. And yet we know you weren't promoting it, but you know what, Doc? That's how you can tell when somebody has a good product. They don't have to promote it. You just live by example and they'll catch on.
It sells itself. Fauci today came out on the news and he said that we need to implement new measures. And he said not only masks, people need to be wearing shields, some type of eye protection, face protection. That was on the news today. You know, and I think it makes sense. I mean, I don't want to wear anything either, but what are we going to do? But every time I see patients, I'm wearing a shield. I mean, I have to protect myself so I can do what I do.
Right.
It's inconvenient, but it is what we're dealing with now. And again, just like I said, if we struggle to push through this, we're going to survive this. So it's gambate.
Okay.
Gambate. Thank you, Doc.
Thank
Charlie,
you, guys.
Any closing comments real quick, Charlie?
Well, this has been a very emotional but impactful segment that we've had tonight. I want to take this time to thank the viewers again. Thank you so much. Mel and I, we have the utmost love for all of you. You've been with our this journey for 4 months, over 4 months now. You never swayed. We've had a lot of controversy on the show, but you've all persevered through the controversy. I saw a comment tonight, and I just want to let you know, we are compassionate in what we do, but we're not political. Okay, let's just get that straight. We don't endorse any political affiliation, because politics will not beat this thing. I'm going to tell you right now. You got to take the bull by the horns, because most bullfighters I know, the bull doesn't care if you're a Republican or Democrat. If it's going to gore you, it's going to gore you. So the thing is, you got to be able to fend off this thing and do it right. We bring on the people that have knowledge of what they're doing so they can help guide us, because most of us are lay people. Like for Mel and I, we're investigators. That's about it. But we know how to dig for the information, and we'll get the information out to you. And if you can use the information, by all means, that's what we do. We get the information to you so you can use that, whatever we tell you. So on behalf of Mel and I, my partner over here is emotional tonight, but I know where his passion and his love is. And again, since meeting Dr. T, it's always been a pleasure, because this guy has a lot of spunk. And I believe it's because he cares about life in general. And he does everything possible to keep his patients alive. And so I want to be the same. Whatever I can donate, I'm going to do it. And if it means every night, because most of you know that first passion has always been me playing music. And I sacrificed all the way until Kalaheo Steak and Ribs closed. I sacrificed all those nights of not playing music, because I felt this was very, very important for me. And I'm going to keep on doing this until the good Lord one day takes us home, whenever that comes, who knows? But if we live right, we should crank out many more years. So thank you. Thank you.
Well, my passion was playing music too, Charlie. Playing them on my iPod. That's about all I can play. Triana, thank you, Triana. Another $500 donation. And I mean, Lori, I mean, Valerie, Sarah, Suzanne. I mean, the numbers don't stop. The names, and we there's no way we can thank all of you, but thank you so much. You guys are gonna make a bunch of kids happy and safe, and possibly save their life. That's just how I see it. Awesome, Doc. You were there for Kauai when you came and did the testing. You came and brought your staff, and you did what you did, and we'll never forget that. And then tonight, oh wow, unbelievable. We appreciate you, Doc. We love you. We thank you. You stay safe.
Thank you. Well, I love you guys. Thank you.
We
I hope we can make a difference.
Oh, you already have. You already have. So with that, I'm gonna get that out of here and go get my Kleenex. I'm so sorry. Just
Hey, Mel.
Gambate, be strong, cry.
Yep.
Hey, Mel, you got two people I want to shout out before we close out. Laurie Nakama, thank you for your 200. And Roy Asher, thank you for your 100, brother. Thank you very, very much.
Thank you, guys. Tomorrow night, 7 o'clock, we got Mayor Kawakami up here. We'll try to squeeze out a couple $100 from him as well. Doc, we love you, man. Take care. Stay safe. God bless all of you. Have a great evening.
Thank you.
Take care.
Bye, guys.
Aloha.
Bye.